pledge will be led by the gentlewoman from Texas, Ms. Johnson.
I'm here this morning just to address education. How do we know? Because the people have told us so. We represent the ideal way to alleviate the shortages is by ensuring that children of all races and both genders receive the basic grounding in science and mathematics that will prepare them to pursue careers as scientists, engineers, and technologists. Is it not time, then, for America to grow morally? For those who fear to answer this question, I will answer it for them. The time is now.
Now more than ever, what happens in Washington impacts us here in the Dallas-Fort Worth area. Your Congresswoman, Bernice Johnson, will help you understand what goes on inside the federal government and share perspectives from today's leading policymakers and opinion leaders. And now, your Congresswoman, Bernice Johnson.
Hello and welcome to the Capitol Report. We have a very interesting interview coming today. I'm being joined by Kathleen Stoll, who is Deputy Executive Director and Director of Health Policy at Families USA. Families USA is one of the most prominent organizations working to promote high quality and affordable health care for all Americans. And she and I will be discussing health care reform to see where she is and what the families support. She has had a long career in health policy. So prior to joining Families USA, she worked at the Center for Women Policy Studies, where she served as director of the National Center on Women and AIDS Policy and director of public policy. And prior to that, she worked here on the Hill. Congressman Robert Matsui of California, who was a well-known, well-respected member here, and for Ways and Means Committee. So she's very aware of the pay end of health care and all. So I'm delighted to welcome you.
Thank you.
And thank you for taking time to come.
I am delighted to be here with you this morning.
Give me some of your perspective on what we need in health care reform.
Well, first of all, I think most of the folks out there know what the problem is. We not only have millions of uninsured Americans, it's 47 million, going up probably up to 50 million, but we also have lots and lots of hardworking Americans who can't afford their insurance. Their premiums are going up 5 or 6 times faster than their wages. So we're in a situation that can't be tolerated or sustained. We have people who really can't afford health insurance. That's the problem. And I think that's what the leadership in Congress and the President are trying to address. Affordability. That's the key issue.
When we say affordability, how can that be addressed? There is so much discussion on the public sector and a lot of emphasis on people that don't want a public sector. Does that mean that it will be a portion of it that you support that would be public for all that cannot afford health care?
Well, I think what we're talking about, as you know, is building on what we already have in this country. It's a uniquely American system, and we're proud of it, and it serves a lot of people very well. So we want people to be able to keep what they have now if they like it. A lot of folks get that through the employer's, their workplace, employer-based coverage. Other folks do get support from public programs like Medicaid that serve our lowest income folks, our people with disabilities who are most vulnerable. And frankly, those are people that insurance companies are not anxious to serve. So we're going to build on this system, and we're going to expand access to public programs for the very poorest people, but then we're going to give the rest of America some new choices and some help with the costs. We're talking about subsidies for premiums. So if you're an average hardworking American, you may find that you're paying thousands of dollars a year for health insurance, and you're getting less and less coverage. You're seeing less benefits covered, higher deductibles. We're going to help with that problem. We're going to provide a subsidy for premiums, but also make sure insurance companies provide good coverage and treat you fairly.
You know, I keep hearing about they would have access to insurance like the members of Congress. You know, I pay for every bit of the health care that we have. How is that interpreted? I mean, how do we come to that question?
Well, I think there's a lot of folks out there who don't have employer-based coverage, who can't buy coverage even if they're willing to pay any price for it. Insurance companies can turn down people who have a pre-existing condition, who have less than perfect health. And members of Congress are guaranteed that they can purchase coverage. So we want to do that part of the system. We want to mirror that so that everyone can buy coverage. First of all, no one can be turned down by an insurance company. Then we want to make sure the coverage you buy is good coverage, that it's there when you need it with the health care services that you need. And we want to make sure you can understand what your choices are. Transparency in how that information is presented. And again, we want to provide you some help paying premiums. That's the kind of plan that I see members of Congress like you talking about. And, you know, I think that Republicans and Democrats agree about 99% of what we're talking about. There's a few tough issues that have to be sorted out.
I hear that on the front end it would cost a lot of money, and then it gradually comes down. Do you understand how that formula works?
Well, there's no question that helping everyone have affordable quality choices is going to cost some money. I wouldn't be sincere if we said it's free. Nothing's free. There's no free lunches. However, if we make this system work efficiently so that people get the care when they need it and they don't have to resort to an emergency room after they're much sicker than they should be, that saves us a lot of money. We have to make sure that the way we pay providers makes sense, that we pay them for quality, so that'll save some money. And frankly, by covering people who are now uninsured, we can save a lot of money. Every one of us who has insurance, our premiums are about $1,000 higher every year because we are actually paying for the cost of the uninsured in the system. President Obama talked about this yesterday. He calls it a hidden health tax, and that's exactly what it is. We don't want to have a hidden health tax. We want to know what we've got, understand how it works.
You know, healthcare costs has gone up very dramatically, and at the same time, the restrictions have become much more restricted. In some of the insurance companies, I have Blue Cross Blue Shield. They will tell you what physicians they reimburse, and if they're not on the list, then they'll tell you they don't reimburse them. How do we correct that?
Well, I think we want to create something that'll be called an exchange or a gateway, where you can pick out the insurance plan you want or keep what you have now, and you'll have a choice of doctors. The President has been very clear that we don't want to take away the choice of insurance plans or your choice of doctors. So that's not what we're talking about. What we are talking about is the 9.3 million uninsured people in Texas. We're talking about 5.3 million of those work. They're hardworking full-time and they don't have insurance. And we're talking about people who have insurance, who have astronomical medical bills even though they're paying for insurance. And I think those are the issues that we need to address. And the exchange will provide some solutions to those problems.
You know, there are facilities now, I'm told, that if someone is very ill and go to the hospital and they don't have insurance, they might do a little palliative emergency care, but then they'll send them home. Have you heard about that practice?
Oh, that's a good point. I think there's a perception out there that if you don't have insurance, that you'll still get care through some system of safety net providers, and that's not really true. We do have community health centers, but they can only provide so much care. And when you go to the hospital emergency room as an uninsured person, the only obligation is to stabilize you, and that can be pretty minimal. Just stabilize you enough so that they can ship you perhaps to another hospital. That's what happens to the uninsured, and so that's what makes insurance so important.
Well, there are a number of working people that are not insured, and I had operated a long time under the illusion that if you're working, the job can negotiate an insurance plan for you. Is that not happening?
Well, there are a lot of folks who get insurance through their employer, but there's a lot of lower income, hardworking folks,